Welcome to New York Hotline. I'm Bob Herbert. Drugs and AIDS are ravaging our city, and hypodermic needles are one of the main avenues for transmission of AIDS. Studies show that half the city's 200,000 IV drug users are already infected with AIDS. That's the worst concentration in the world. In Portland, Seattle, Tacoma, Boulder, Colorado, San Francisco, and now New Haven, Connecticut, clean needles are being given out in an attempt to cure the spread of this deadly virus. However, big cities like Chicago, Boston, and Los Angeles have rejected such programs. Why? Many people, especially African American leaders, feel free needles condone drug use. And that's why Mayor Dinkins and his new health commissioner, Woodrow Myers, scrapped New York's needle exchange program. Myers also wants to drop funding for a program that teaches junkies how to clean their works with bleach. This debate is loaded with legal, medical, political, and racial issues. And here to discuss them with me are Sterling Johnson, the city's chief narcotics prosecutor, and Dr. Don Desjarlais, director of AIDS research at Beth Israel Hospital. But first, we're going to talk by phone with Elaine O'Keefe, who is the director of the AIDS program in New Haven, Connecticut. Elaine, are you on the line?
Yes, I am.
How are you?
Okay, how are you?
Okay. Listen, why did you adopt the needle exchange program up in New Haven? Tell us the genesis of this project.
Well, it's been in the works for well over a year now. I have to start by saying that we do not yet have an operational, legally sanctioned needle exchange, in New Haven that is. But our state legislature just passed a bill this May that will pave the way for a program like this to begin.
Elaine, let me interrupt you. Can you turn your TV down? We're getting some feedback.
I don't have a TV on here.
We're getting feedback then right here in the studio. Anyway, go ahead.
Well, what I was saying is that we've just passed the legislation recently that will allow us to start a needle exchange program in New Haven.
Mm-hmm.
And the reason why we have been advancing this legislation for over a year now is because of the clear public health imperative to stop the spread of AIDS and to save lives.
How serious a problem do you have in Connecticut, in New Haven?
The AIDS epidemic in New Haven, I can't say that it's exactly the same as the epidemic in New York City, but there are many similarities. The face of AIDS in our city is increasingly one of IV drug users, of women who are IV drug users themselves or sex partners of IV drug users, and also of children.
Mm-hmm.
About 70% or more of the people with AIDS in our city have been IV drug users.
We have to apologize for this technical difficulty, but we can hear you, so go ahead, Elaine.
Okay, well, I can hear you fine.
Okay.
So what I was saying is that it's been clear for a long time that the only way that we are going to stem the spread of AIDS in the city is to break the volatile connection between AIDS and drug use. And so we see this as a public health imperative, as I said. It's public health practice.
In New York, there's been quite a political brouhaha over our needle exchange program, which is now being scrapped. How big of a political problem did you have getting approval for this in New Haven?
We have not had a big political problem getting approval for this in New Haven, but I think that we have done a lot of groundwork to reach that stage. We have been educating the community, legislators, public health officials about the rationale for needle exchange for well over a year now. And I think that this has certainly paid off and that people now see this program in a reasoned light, and they also see it as part of a comprehensive strategy. We don't propose that needle exchange alone is a panacea. We present it as part of an overall strategy that includes drug treatment, counseling, education, and all of the other pieces that we have had in place for a while. Now we're adding the needles to stop the transmission most directly.
Right. In New York, many African American and Latino leaders have been opposed to handing out clean needles to addicts. Did you run into any kind of a problem like that in New Haven? Is your African American leadership and Latino leadership on board with your program?
We have had the support of the statewide Latino AIDS Advisory Council. We've had support of other groups in the Black and Latino communities. In fact, the bill was co-sponsored by Representative Bill Dyson, who is a black legislator from New Haven and the co-chair of the Appropriations Committee in the legislature. It has also been supported by our mayor, who is a black man. And we cannot say that there is no opposition out there. I believe that we have to continue to educate and bring people to understand that this is something that we have to do to save lives, and something that can be done in a way that will not do any harm to the community or promote drug abuse.
You seem to indicate that there was some legal problem. You said it was not fully legally sanctioned. What kind of problem do you have?
Well, what I meant by that is we don't have a problem. The program that has been passed by the legislature is a demonstration program, and it will be legally sanctioned. What I was saying is that, in fact, we do not today have that program in operation.
When's it going to start?
It should start by August or September. We have to go through the process of putting together a protocol, and we are contracting with the state, who is providing the funding. And how extensive is your program going to be? How many people are you going to try to reach? We're hoping to serve at least 500 addicts in the first year.
Do you know how many IV drug users you have approximately in New Haven?
Well, there are gross estimates. I don't say that I stand strongly by these figures, but we are told that between 2,500 and 3,000 is about the number of IV drug users in the city.
Okay, thanks very much for talking with us. I appreciate it. Good night. Sterling, you are opposed to the exchange of clean needles.
I am.
New Haven has started it. A number of other cities have started it. Our other guest, Dr. Desjardins, is in favor of it. Why are you opposed?
First of all, it does not serve the purpose it attempts to serve. Number one, you look at an addict who's a very, very unreliable human being. He doesn't wash, brush his teeth, change his clothes. You're going to give him a needle. He's going to go into some shooting gallery unobserved, and you're going to depend upon him or his word that he's using a clean needle every time he shoots up. We also don't take in consideration what about the cotton that he's going to be using, the works. So you don't really know that he's using this particular clean needle.
You've no way of monitoring what he's doing.
No way of monitoring at all. The other problem that I have with it as a citizen, this was a policy that was formulated by non-African Americans and foisted upon African Americans without any input from African Americans. And if you look at your drug users, intravenous drug users, and I'd venture to say 70 to 80% of them are African Americans and Latinos.
Okay. Don, your shot. You take a diametrically opposed view.
Pretty much.
Okay.
I strongly support the position that's been taken by the National Academy of Sciences that here in the United States we should be conducting research on syringe exchanges to find out if they do work or if they don't work. Clearly the European experience has been basically positive in terms of getting the syringe back, removing a potentially contaminated needle from circulation. The European studies show about 75 to 85% of the syringes come back. Cities like Amsterdam find that the playgrounds are safer. Since they started up a needle exchange on a big scale.
Explain how.
Well, before they had a needle exchange on a big scale in Amsterdam, they used to have a lot of dirty syringes in their playgrounds. You know, addicts would use them, and once they were too dull to use again or something, they would just leave them around town. Now they're bringing them back to the syringe exchange, getting clean ones, and the playgrounds are safer. The dirty syringes aren't scattered around town. The drug users do take them back. You know, whether it would work here in the United States, we'd have to see. But there's no way of automatically saying, yes, it would be tremendously successful, or no, it would be complete failure.
Now, you say we should do it on an experimental basis, though. So you're talking about a small program, small number of addicts that we
not as small as the one that we had here in New York.
We only got to, I think,
300 some people. That's probably too small. But there's certainly something in between the 300 that we tried and trying to reach all 200,000 IV drug users in the city. We're not
actually,
ready to try that.
In order to really do something about the spread of AIDS, you need to get to a large number, which means that eventually you have to get to the most irresponsible addicts. It would seem to me they're the ones who are most likely spreading AIDS at the fastest rate.
Sure.
Is there any evidence anywhere that these hardcore addicts, the ones that you referred to as extremely irresponsible, that they can be depended upon to do the right thing with needles?
There's some evidence, but not all addicts are the hardcore, completely irresponsible ones. That may be a relatively small percentage of them. I mean, no addict wants to die from AIDS. It's a terrible way to die. It's very, very painful, and even the most irresponsible addicts don't like pain. It also involves transmission of AIDS to your sexual partner, to your kids. Even a very irresponsible person will think twice about spreading a deadly virus to their family and their children. I don't think that any program, treatment on demand, over-the-counter sales, syringe exchange, bleach distribution, is going to be perfectly effective. We need to try a wide variety of things to see which ones work relatively well, which ones don't work so well, and then go with the ones that seem to work well. Obviously, we know treatment works, but we have to do more than our present forms of treatment.
You know, the proponents of needle exchange, they like to bring up the European experiment. And the culture of the European addict is as different from the Afro-American and the Latino as the Atlantic Ocean is from the Pacific Ocean.
Give us some examples.
First of all, the majority of European addicts over in Amsterdam are not black and Hispanic. Second of all,
but does that indicate that there is a difference, though, in the behavior?
Yes,
of the
there is.
junkies?
Yes,
Tell us about that.
They congregate more here. There are more addicts. There is a network. There are something like 250,000 heroin addicts in New York State, and maybe 200,000 of these are in New York City. They have a culture and a language all their own, and it's different than it is over in Amsterdam. Another problem that we have, you have to concern yourself about crack also, because crack is helps spread AIDS. You've got the young ladies who can't have or don't have enough money to purchase crack, so she will go and prostitute herself and thereby spreading AIDS. So therefore, the logical step is, then maybe we should give this young lady crack so she won't prostitute herself.
My experience is
I don't think that's a logical step, but I think we may need to give that young lady condoms. We certainly need to provide treatment for her crack problem, and we may need to give her condoms. But I don't think anybody's saying we should give her crack.
You made a very rational presentation as to why we should be in favor of exchanging needles, but it also requires that the addict act rationally. My experience in covering this problem in New York, both crack and IV drug use, sometimes I've seen them in the same apartment. I've seen crack users in the living room and IV drug users in the bathroom. But much of the behavior is extremely irrational. Is there any way, and this is widespread, is there any way to crack through that irrational behavior so that we can be more confident that the needles are being used safely? I mean, I think that's what worries many people in the community.
Yeah. You know, one way of cracking through the irrational behavior is you surprise people. And certainly when syringe exchanges have been set up here in the United States and in Europe, it's a surprise to the drug users. They weren't expecting syringe exchanges. That makes them stop and think about, what am I doing? Here's somebody, a public health worker, giving me a needle.
You burst in on them as they shooting up?
No, you walk around on the streets and you go up and talk to them. It's going into the shooting galleries is a little too dangerous, but you go out to them on the street and you talk to them, you give them bleach, you give them a condom, you give them a sterile cotton. That sort of breaks their mindset about what they're doing. It makes them think about health a lot more than they thought about health before. That doesn't guarantee that they're suddenly going to become responsible. A lot of them are not going to be responsible all the time. Maybe none of them will be responsible all the time. But it's a little like condoms. Condoms don't work all the time. nobody uses condoms all the time. But as far as we can tell, condom use does reduce transmission of the virus. Sterile needles might also.
Now, we're going to take calls in a few minutes, so you can start calling us and we'll answer your questions and listen to your comments. One of the things that seemed to have been, New York's program basically was a failure. It was an experimental program, had a lot of problems. And I'll let you talk about that. But one of the things that I thought was impressive was that a large percentage of the people who did come into the needle exchange program actually continued and went into drug treatment programs. I don't know how many finished.
Over half.
Can we expect that would happen generally in a needle exchange program? And do you see that as a benefit?
Well,
Sterling does it, but we're going to get to that in a minute.
No, I think getting them into treatment is a real benefit. If you look at, say, the Tacoma syringe exchange, which serves about 300 drug users a week which is about 10% of the drug injectors in the city, again, where most of the drug injectors there are black and Latino, they have a fairly substantial rate of people going from the syringe exchange into treatment. It's not as high as New York's, but it was substantial. Again, the European studies show people going from syringe exchange programs into treatment. So we should be able to expect 10, 15, 20% of people to go on into treatment.
Well, first of all, the people in the New York program were taken off of treatment lists and put into the needle exchange program.
Wait, explain that to me, because I'm not aware of that.
Yeah.
Who took their names off a list?
Whoever started the program, the people who are exchanging needles, people who are screened from treatment lists.
They were waiting to get into treatment.
Waiting to get in, right? Yeah. So they were going to go into treatment anyway.
The program was not promoted that way, though. I mean, we got the impression that these were going to be addicts off of the street.
It wasn't off to the street.
And what I saw, they had a problem, and they weren't getting addicts to come in. And now you're telling me that they actually went to lists and recruited addicts.
Well, there was lists, but these were people who were going into treatment who wanted treatment. And instead of getting treatment, you got clean needles.
So these are people who wanted to stop using drugs.
That's right.
But don't we want to reach people who, one of the things with junkies is that they want to do drugs. I mean, hardcore junkies,
but
in many
junkies also
cases,
want to stop using drugs, too. Everything, they wake up in the morning, and every time they suck God's air, they said that, number one, I want to get a fix, and number two, I'm going to stop shooting drugs.
Well, in any event, we only got 300 and some odd people in this experimental program, which I think cost $250,000 for 300. That seems awfully expensive.
Oh, it was expensive, and it.
But how come we got so few people?
Well, for the location was not user friendly.
That's true. It was downtown.
It was
here
downtown.
In the City Hall area on Worth
convenient.
Street,
it's right across the street from my office.
Right. Yeah. I mean,
near the cops.
Nothing
That's a great
against
place to have
Sterling, but
junkies show up.
it's not the best. Right across from his office is not the best, most convenient place for a syringe.
Sterling, who was trying to sabotage the program?
No, the reason they did that, when they set up these programs, for the needles, they set them up within 300-400 feet of a school, so the community was outraged. And what Dr. Joseph did, I think, was to say, let's put it in a neutral place, and we'll put it in the Department of Health, which is at 125 Worth Street, and it just happens to be across the street from my office.
Politics?
Oh, certainly. I mean, the community was quite upset. And the original idea was to put them in community health centers.
It was supposed to be in Harlem and Brooklyn, I think, originally. Is that correct?
They had 4 locations, and 2 of them were going to be control situations where people were not given syringe exchanges but were enrolled in the study to see how many of them went on into treatment anyway, and 2 places were going to give out syringes.
The community was not a participant.
Was it Harlem and Brooklyn?
It was Harlem and Brooklyn. I think it was in Bushwick. I think it was lower in the village somewhere.
Chelsea.
No. They weren't consulted?
No, they were not consulted.
Okay.
The other thing is that I have seen a report, but the report of this needle exchange experiment has not been publicized. And I can tell you that the premise of the needle exchange program was that we're going to stop the flow of AIDS But the report that I read, I think the flavor of it was that it was successful because we got a lot of people into treatment, which is a little different than the original.
That wasn't
program.
the original.
That's right.
That's right. We've got Yolanda Serrano on the line. She's the director of ADAPT, which stands for Association of Drug Addiction Prevention and Treatment. And Yolanda, are you there? Yolanda.
Hello.
Yeah. How are you?
I'm okay.
Okay. Listen, one of the things we haven't discussed yet on the show is the problem of AIDS-infected children, the babies. I'm told that you have some ideas on how we can go about protecting them. Is that correct?
Yes, and basically it's through the same methods that you've been talking about.
You're in favor of needle exchange because of the problem of the AIDS-infected youngsters.
Well, through their parents, through the drug user, they're infecting their sexual partners and therefore their children.
Mm-hmm.
And it goes back to protecting the public health. If we do not care about the addict, we sure have to care about their families who are being infected. And this is my concern at this time also. I've been hearing some of the comments, and this, I can't believe what I'm hearing. Most of those people that were on the needle exchange program were not, in fact, taken off drug treatment lists. They were taken off the streets. My organization, ADAPT, was responsible for recruiting about 40% of those people. If you read the report, the 10-month report, you would look at the statistics and would look clearly where each of the percentages of people came from. And basically, the people that were taken off the street, most of them were HIV positive, and if you took one person off the street who was infected and helped them and counseled them and put them into treatment, I mean, I think you've done a tremendous amount of work to prevent other people.
What about Sterling's point that in many cases the junkies do not act rationally, and you can't trust them to use the needles properly? What's your response to that?
This is not true. We have a program in Brooklyn that Don Desjardins is aware of where we're working with active drug users. We have groups with them. They come in and they do their own cooking. They come in and they do their own bleach kits. They come in and discuss the issues of AIDS. They protect each other. You know, but this is because we're in this particular neighborhood on a steady basis. And it's working at least in this area that we're in.
Now, with all due respect, I have seen so many junkies in so many neighborhoods, and they're not cooking and they're not keeping house. I mean, they're on the nod and they're sharing needles and they're mugging people and they're ripping off cars and that sort of thing. Now, this is a substantial percentage of the junkie population, isn't that right? And aren't these the ones who are more likely to be infected and also to be spreading AIDS?
Let me put it this way. Drug addiction is a disease, and what we're talking about here is the disease of addiction. And, of course, if they are sick and they need their fix, like we call it, or their drugs, they're going to have to do what they have to do to get that, because since 1972, no new drug program has opened up here in New York City, New York State. Therefore, we are not being responsible to their needs. What are they supposed to do? And the other thing is that addicts share needles. They certainly do because of illegal reasons, scarcity reasons, and economic reasons. Economic reasons basically because they basically have enough money for their drugs. And they go into these shooting galleries. Well, they have access to needles and access to a place to shoot. And scarcity because there's sometimes no needles in the streets and they're forced to share it and therefore get infected. So, you know, when I hear the stuff that they love to share needles, if you talk to these people, they are like you and I. And I don't want for one moment for your public to think that addicts are just black and Hispanic addicts. That addicts are people that come into these neighborhoods, white people, professional people,
they're not
lawyers,
all
your doctors, your correction, your police officers, etc.
All right, Yolanda, your IV drug users are not all, I got to interrupt you, are not all African American. Whoa, Yolanda.
I hate
Hello.
to focus on Hispanics and Blacks.
All right. I agree with Yolanda there. Not all addicts are not African American or Latino, but I understand you didn't say that, but we have to, I have to disagree with the contention that they are mostly rational, ordinary people who are going through their day-to-day activities. But I want to get on, want to move on a little bit. Tell me what percentage of IV drug users in New York are already infected with AIDS. Do we know that?
Best guess is about 50%. 100,000 out of the 200,000.
Half, 50%. That's.
I wouldn't quarrel with that. I'm not sure, but I wouldn't quarrel with that.
Okay. To what extent would an experimental program, we've already got half infected, to what extent would an experimental program even help? How much would it even slow down the infection rate of the other half? Do we have any idea at all?
Well, you wouldn't do an experimental program for the other half. You would do an experimental program to see how many people brought back their syringes, how many people acted responsibility, how many
But the point would be to prevent the 50% from infecting the remaining 50%.
If the experimental program worked, then you would think about expanding it to a public health scale. I mean, some places in the world already have done that. Here in New York, clearly, before we're going to be able to do it on a public health scale, we would have to show that it worked on an experimental basis. And we're not trying the experiment here in New York anymore. New Haven will be, Seattle is, San Francisco is, Honolulu is, but we're not.
Okay, let's take a call. We've got a recovering addict on the line. Hello, are you there?
Yes, I'm here.
Go ahead.
I'd like to address Mr. Johnson's point that addicts are not responsible people. As a recovering addict, this man has never used drugs. He's not in a healthcare provider position as I am right now. I work for ADAPT. I'm program coordinator for ADAPT. As a recovering person, does he realize that long before AIDS, addicts were always very concerned about contracting hepatitis? They did everything they could to clean their needles so as not to contract hepatitis.
Okay,
Water does not work.
Let's give Sterling a chance to
clean their needles with bleach because we can't give them needles. There are 39 states in the union where people can buy needles.
Can we give Sterling a chance to answer your question?
We do.
Sterling, go ahead. Give it a shot.
I say the addicts are not responsible because if you've got a habit of $500 a day, you must lie, steal, cheat, and do whatever you can to get those drugs. And that is not a responsible person. It's a sick person, but it's not a responsible person.
Now, this is you're talking about a portion of the addict population, a segment of the addict population, not all IV drug users. Is that correct?
Well, except those IV drug users that have access to the drugs. And I won't say a large part, but a substantial portion of the medical profession do have access to drugs. These addicts, not all of the medical profession.
But a lot of the street addicts that we see in the neighborhood.
Lie, steal, cheat, do whatever they have to do.
They start the day without money.
Hustling to get the money for the drugs.
Okay. Don, how about this type of addict?
Well, that is a real worry. But even the most irresponsible person doesn't want to subject himself to the pain involved from dying from AIDS. Clearly, if a person...
But the question is, but that's a very rational statement. The question is that person thinking at all about anything besides his or her drug? That's the part that worries me.
Yeah.
We're going to give them needles, and I have seen addicts who are really, I've seen addicts ripping off people. I mean, they're like out of their head. The idea of handing that person a hypodermic needle and saying, all right, now do the right thing, I'm skeptical about that.
Well, skepticism is a wonderful thing to have in the middle of the AIDS epidemic because it's a real crisis, and we need to have skepticism. But I think that in addition to the skepticism, we need to be trying things. We need to be trying bleach to see if it works. We need to be trying syringe exchanges. European countries, with the exception of Sweden, are trying simple over-the-counter sales. That for 10 cents you can go in and buy.
We'll get back to the question of how these things work. Do we have a caller on the line from Long Island?
Yes, that's my question. Why isn't over-the-counter sale of needles mentioned as a serious alternative? And let the addict choose. I believe they're 20 cents a piece here.
That's a good question. Now, in many places, it's legal to sell hypodermic needles.
In New York, it's not.
In New York, it's not.
It's one of those 13, 14 states. You must have a prescription to get a needle.
Does that make sense? Why is it okay in some states and why are we banning it? I take it you're in favor of banning it.
Well, the legislators say that this is against the law to do it. Whether I like it or whether I don't like it, this is the law.
What do you think would happen if needles were on sale? Now, we are not actually going out recruiting addicts, but you could buy them in a drugstore or wherever you buy them. What do you think would happen?
I really don't think that the addicts in New York would buy clean needles, because if they've got 20 cents or 40 cents to buy a clean needle, they're going to pool this money together to get drugs. If you gave an addict a pill and you say, take this pill, it's going to save your life, an addict is going to take this pill, he's going to sell it, get himself some drugs, and maybe he can get a pill later on.
I think that's an insult to American addicts, black, white, Latino, Hispanic, Chinese, green, whatever.
What do you think?
France changed their law. They saw AIDS was already there. They said, all right, we're going to permit over-the-counter sales. They did a lot of education work with the pharmacists who needed the education, and they're finding about half the addicts in France are going into pharmacies and buying sterile needles. I think that we should be able to do at least as well as France.
We got a caller on the line from Brooklyn. Hello.
Yes, good evening. Mr. Herbert,
how are you?
Prosecutor. I'd like to ask basically whether you, in the future, in view of possible success in other cities with needle exchange programs, would you consider instituting a program here in New York City on an expanded scale compared to the small 300 number that was done before?
Don?
Oh, I would certainly favor
you want a bigger
bigger program, again on a research pilot basis. But
in the real world, though, this is not in the cards. I mean, if the mayor is against it, it's dead.
I would say absolutely. First of all, it is dead,
right?
And hopefully it'll stay dead. I would absolutely be opposed to it. You can't, on one hand, say to the kids, say no to drugs, and at the same time give out clean needles to addicts. And what is an addict going to do with a needle but shoot up?
Right.
So there is an inconsistent message there.
Okay, we're taking your calls on New York Hotline. Is there a caller on the line from Brooklyn?
Yes. Can you hear me?
Sure, go ahead.
Okay. I tend to agree with Mr. Sterling Johnson about this issue, and my point may be a bit different. I'm curious to a reaction. I think that in seeking people out for special treatment who've already committed themselves to abusing drugs and who've already chosen to sacrifice their well-being at the expense of the entire rest of the public in terms of crime, which is probably the basic factor, in terms of their economic situation becoming dependent on society, the rest of us become victims. Now, we're seeking out these people because, in a sense, they have made themselves victims. When, in fact, the people who are victims of crime every day on the street of New York, which we've sort of written off, get very little in the way of treatment after their victimization, and in the way of prevention.
All right, you're true, and crime is a huge problem. Do you have a question though?
Sorry, I can't hear you.
Do you have a question?
Yes, I do. I can't hear you, though. I see you on my TV talking, but I can't hear you.
Can you hear me on the phone? Just if you have a question, ask your question. We'll try and answer it.
Yeah, my question is that why should we spend resources on people who've already written their lives off to save somebody who's already committed themselves to being a lost person? Instead of spending these resources on the innocent public.
Okay, Don, you take a shot.
I spent 10 years working for an ex-addict as head of the Division of Substance Abuse Services. I would hate to think that he was a lost person. I would hate to think that we can't help people with drug addiction problems, alcohol addiction problems, nicotine addiction problems. I think there's a real chance for recovery for large percentages of people with drug problems. And also, I think the idea that letting them die from AIDS is going to cure our crime problem is totally false. The crime problem has not gotten better since AIDS has come along. If through the next 5 or 10 years, everybody should stop shooting drugs or die from AIDS, that won't get rid of our crime problem. We will just have more people doing crack, which doesn't spread the virus itself, although it leads to a lot of sexual transmission. So we're not going to get rid of our crime problem by allowing HIV to spread. If anything, we may make it worse.
Sterling, that's your bailiwick crime. Tell us
I happen to agree with him. I'm not ready to write off a generation of people who are sick, and an addict is sick. And unfortunately, we don't have enough facilities to give treatment on demand, and they should be treated because they are sick people. And I'm just not ready to write them off. I happen to agree with Don on this particular point.
Okay, another caller. Hello.
Hello.
Hi, are you from the Bronx?
Yes, I am.
What's your question?
Okay, my question's directed towards a doctor. That I want to know where he lives. Number one, if he lives in New York City, and number two, if he's from New York City, because apparently this is a far-fetched idea which can't work in New York City.
Okay, I do live in New York
And then
City.
I'd like to make a little comment after.
Sure.
Okay.
I do live in New York City. I've lived here for 18 years now. I have been a victim of street crime in New York City. And as I mentioned, I've worked for ex-drug addicts in New York City.
Okay, I'm a police officer in the Bronx for the last 7.5 years. Now, you kept on referring to the addicts as African-American addicts, Latino addicts, white addicts. I like to refer to them generally as all addicts because they're all in the same group. They're all addicts with a problem. And during the course of their usage, they don't have a rational mind. They're not thinking straight. Maybe in the morning when they wake up and they breathe that fresh air, maybe they want to say they want to get off. But during the course of the day, they lose their train of thinking, and all they care about is getting high and getting a fix.
Let me ask you a question.
Yes.
As a police officer, what's been the attitude of your fellow officers as far as the idea of needle exchange?
Well, a lot of people feel this is a way of just promoting more drug use, because I came across a couple of addicts on the street who, time to time, we stop and talk to people while patrolling, and they said they know of one person who went to that program, brought back the needle, went to the gallery and shared the very same needle that he was supposed to use for himself, and he shared it with other people in the gallery and charged the people for it.
Okay, thanks for your comments. Sterling?
That's the problem you have with this needle experiment program, because you're going to give a needle to an addict and you're not going to observe him use that needle for himself, a clean needle, each time he shoots up. You don't know whether he's going to share it or not.
Now,
and the police officer is right.
Now,
Certainly, even with a big-scale syringe exchange program, much bigger than anything anybody has contemplated for the city of New York, some people going to syringe exchanges will share. Yeah, just like some people getting condoms are still not going to use them.
Most addicts will share. It's as common and as breathing air. You know, you have an addict who has a clean needle. He has his lady there with him, and she says, "Can I use your needle?" Do you think he's going to say, "No, this is a clean needle just for me"? He's going to share it.
Some will, some won't.
in terms of law enforcement, most law enforcement agencies, this is in New York City now, as far as I can tell, are opposed to it, and the officer said that he and his fellow officers are opposed. In your opinion, why is this? Why?
Well, there's certain conceptual inconsistency between trying to arrest people breaking laws and doing things that may protect their health. And that's people in law enforcement and people in
But that's
drug
on
treatment
a theoretical
field.
or a philosophical level. Do you think that they might have a point on a practical level in the real world?
I mean, there have been studies of syringe exchanges in the United States and European countries and New Zealand and Australia, looking at the question of, do people start using drugs when you have a syringe exchange? No evidence that that actually occurs. The other concern for law enforcement people, and it's certainly real, that we're going to have people injecting drugs for quite a while, at least another 5 or 10 years. You worry about needles being carried around that have HIV in them. And
the latest trend is that people are now smoking heroin like they do over in Asia, chasing the dragon. Yeah. But you also have to concern yourself with a liability problem. Assuming that an addict shares his needle and doesn't bring it back, and he throws it in the garbage or throws it on the beach, someone comes along and accidentally pricks himself with that IV-infected needle. You are flooding the market with already a lot of needles. So I just think it's a bad idea.
Well, that's the Amsterdam experience was that they had a lot less used needles in their parks and on the streets. After
I don't think
they
had 10,000 addicts in Amsterdam. You got 200,000.
It's a different city. If we'd have to try it here to know whether it worked. Yeah.
Well, we got a caller on the line from Manhattan. Hello.
Hello. I would like to know what plan Mr. Johnson has to stop the spread of the virus besides treatment. Treatment alone cannot help everybody. Many people relapse, many people don't want treatment, and IV drug users are the link to the heterosexual population.
So,
how do we stop the spread of the virus?
okay, before you get off the line, though, tell me if you're in favor or against the needle exchange.
I'm in favor of it.
You're in favor of it. All right, Sterling, without the needle exchange, how do we stop the spread? This gentleman says treatment is not enough.
I think, well, treatment is for a course of action after an incident has occurred. I think education is the key. Right now, if you take a plane trip from the East Coast to the West Coast, you cannot smoke a cigarette. We are against smoking. It has taken us 27 years, but Americans have finally realized that smoking is bad for you. We have to do the same thing for drugs, but I don't think it should take 27 years. We can't afford that time.
Smoking's on the way down. Do we have any idea whether drug use is on the way up or not?
Drug injection has been relatively constant over the last 10, 15 years, as close as we can measure it, which obviously is not too closely. Clearly, the smoking of cocaine has increased dramatically over the last 5 years. We're now starting to see some smoking of heroin. The worry there is people might get hooked on smoking heroin, and then if we did cut back on the supply, those people might go to injecting, because injecting is a much more efficient use of drug than smoking.
What do we know about rates of AIDS infection? Is that on the way up, or has it leveled off?
It's leveled off. It's leveled off. I mean, we still have 100,000 people at risk, but it's leveled off over the last 5, 6 years.
Okay, a caller on the line from Brooklyn.
Hi, good evening.
How are you?
I'm in favor of the needle sharing program as an alternative to drug treatment. However, there's been a term that's been kicked around, a war on drugs. And a war implies a commitment, much like, I envision, a commitment like
World War II.
Men landing on Normandy Beach.
I think this is a good point.
That's a commitment.
All right, I've been waiting.
We need drug treatment centers on every corner.
I've been waiting for your call. Let's see if we can get some answers here. Sterling, what happened to the war on drugs? We won it, right?
As Tonto says to the Lone Ranger, who is we, No, we have not won it. It's circular wagon time. They are killing us. I agree, there should be treatment, prevention, education.
This is a big, rich, powerful, smart country. Why haven't we won the war on drugs?
We're not that smart because we are not putting monies into this drug abuse problem. We've got
And is it just money?
Resources. No, because you probably could do more with less money and more of a commitment than you could with just throwing money.
We don't even have the commitment yet.
That's right.
You
got a $150 billion a year problem and only $10 billion.
Do you agree that we don't have the commitment yet? We haven't made it?
Yeah, and I think that there will be big problems in making a full commitment, because we're not only big and rich, we're pluralistic, and there are other big, rich, reasonably smart countries that have drug problems too. It's not as if we're the only country in the world with a drug problem.
Separate and apart from an experimental needle exchange programs, say we give that to you. If you were in charge of a war on drugs in this country, what are some of the major things you would be doing?
Oh, I would have treatment programs for
huge numbers. We're talking tremendous amounts of dollars here.
I would have good street enforcement, because I think that if we don't have safe streets, we lose the war. I would confiscate handguns, because particularly automatic weapons. There's no reason that anybody should own an automatic weapon in this city. I think you will.
What is the reason for someone to have an Uzi, an AK-47?
Yeah. And then you need to go into the schools and out-of-school programs doing good drug education, and then you need to look at some of the sociological problems. That we're a big, rich country, but there are a lot of people in this country who are very, very poor.
Right.
And AIDS is becoming increasingly concentrated among the poor people in this country. Okay. As drug injection certainly has become concentrated. And I think until you get rid of some of those inequalities, you're going to lose the war on drugs.
Okay, we're going to come to your ideas on the war in just a minute, but a caller on the line from New Jersey. Hello.
Hello.
Go ahead. How are you?
Hello?
Yep, go ahead. You're on the air.
Yes. I'd like to ask a question. Is there any treatment programs that exist that physically remove the addicts from the city, from the environment where they can get like more problems and take them far away, upstate New York, not just for a short period of time, but for a long period of time, say 2 years, because they are people with serious problems. They're very sick people, and it seems that they're being treated like criminals more so, and all they do is, as you said before, they keep going back for more and back for more, like any addict, even gambling addict or any addict, lottery addict. Is there a program, are there places where they can physically put them on buses and send them away for 3-4 years, treat them, and then, you know...
Okay, let's get an answer here.
Yeah, there are several good programs, several good Daytop Village, Phoenix House, many others that will remove a person from his environment and take him out of New York and wherever they take him, and they'll treat him. The problem is, once treatment has been completed, that recovering addict will come back to the same neighborhood, subjected to the same pressures, same temptation, and then one of these days...
So this gentleman has a point.
What's that?
This caller has a point, that if you're not removed from the environment for a substantial period of time...
You can be removed for a substantial period of time, but then you have to come back to the same neighborhood.
So what's our answer? We don't have an answer?
I really don't know. I'm not a treatment person.
Because it's your turn now to solve the drug problem. Don had his job.
I'm for treatment. I think, as he says, we have to look at what is it in an individual that makes him so an addictive personality. Why is it that he comes from a family, same love, same discipline?
But are we really going to be able to beat the drug problem looking at issues like this?
You have to. You have to.
I agree, but I mean, I'm asking you to run the war on drugs and win it. And it seems to me that we need a lot more dramatic stuff than that.
Well, you know, we have to do, traditionally we have fought the drug problem in a one-faceted vein.
Law enforcement?
It'd be law enforcement today, treatment tomorrow, education the next time, but you need all of these things operating at one particular time.
Okay. We got a call. Hello, go ahead.
Yes, hello, Bob.
Yeah, how are you?
Yeah, my question is directed towards you first.
Uh-oh.
Hello?
Uh-oh, go ahead. Hello?
Bob.
Yeah, go ahead. What's your question?
Still there?
Yeah, I'm here.
Okay, my question is directed towards you. It's about what do you feel the war on drugs should be, and how do you perceive our action that we're taking now in New York City?
I think we've totally wimped out on the war on drugs at the city level, the state level, and the federal level. I think that the primary reason is that it would cost enormous amounts of money to win it. I think that the benefits from spending that amount of money would be so great that we should go ahead and do it. It would obviously take tax dollars, but it would really be a tremendous number of billions of dollars.
I think they did a survey, and the American people have said, in essence, that they would be willing to pay a tax if the monies were dedicated for a war on drugs,
right.
Treatment, prevention, education. I can tell you right now, the city budget, I'm getting $800,000 less than I got last year.
Yeah, drugs is the engine that is pushing our crime problem, that is pushing the AIDS problem to a great extent, that's behind many of our socio-economic problems, much of the
increased
breakdown
prices
in the
goods,
ghetto, right.
Flight from the city, tax base you're losing.
So if we really made some inroads on this problem, I mean, the payoff would be tremendous.
Yeah, I think the three of us are in real strong agreement on there that not nearly as much as should be done is being done.
Right. Caller from Newark, how are you?
Doing today?
Okay. Yeah.
How you doing?
I'm fine. How are you?
Well, yeah, I'm all right. I just wanted to know. My question is towards your panel and you yourself personally. I wanted to know why there's so much emphasis on the drug use that's basically in the city. You understand? Basically in the city, that's where it usually takes place.
Right.
But we're not talking about the suburbs. We're not talking about where it happens. Where all these college kids, they go out.
How about, but are you denying that there's a tremendous drug problem in the city itself, both Newark and New York City?
Excuse me?
Are you denying that there is indeed a tremendous problem in the city as well, though, both Newark
it's
and...
too much of a problem. I don't think anybody's capable of handling it. I don't think anybody's capable of stopping it.
Okay.
I don't think it's ever going to be solved.
Sterling wants a shot at your question.
Okay, first of all, I think 2/3 of your addicts are between the ages of 20 and 40 years of age, and they are employed. They are in the marketplace. We see, or we emphasize drug activity in the inner city because these people are more visible. The people from the bedroom communities will come into the inner cities, they will buy their drugs, and they will melt back into the suburbs. We did a program in which we would arrest people who were coming into Washington Heights to buy drugs, and we'd seize their vehicles, their Jaguars and Mercedes-Benz. And I venture to say 90–95% of these people are white from bedroom communities.
Didn't that program work pretty well?
It still is working. We've seen thousands and thousands of cars.
Is it cost effective, or does it cost more than? In other words, is this like another layer on the city budget, or is it feasible to expand this program?
It's cost effective, and we've got it in various boroughs in the city. What happens is that when people come over and they find out we're doing this, they'll employ different other methods to avoid. I'm not going to go into it on this program.
I may ask you about that. Yeah. Do we have another caller on the line? Hello? Hello? Nope, I guess not. Then now I'm going to push you on this. Somebody comes in, they find out that the car is going to be seized, or maybe mommy or daddy's car is going to be seized if I go into New York and buy drugs. So now I'm looking for another route. What are they doing?
I'll tell you later.
Give us an idea.
Okay.
Because I know you're already trying to combat it, so you're not going to tell any tales out of school.
One of the things that they're doing, they use rented cars.
And what happens if you see? Do you see?
In order to seize a rented car, I'm going to have to show that the owner of that car, whatever company it is, knew that that car was going to be used for a drug transaction, and you can't do that.
And, nothing much happens to a buyer if they get busted.
He's arrested for illegal possession.
I know, but nothing much happens. Is that correct?
Very little time served. Last year, New York City Police Department made over 300,000 arrests, and of those, 100,000 was for narcotics. So 1 out of 3 person who was arrested for anything was arrested for narcotics.
Okay. A caller on the line from the Bronx. Go ahead.
Hello?
Hi.
Hello?
How are you? Can you hear me?
Hello?
Can you hear me? No, I guess I guess you can't hear me. Hello? Caller on the line from anywhere. How are you? Hello? Nope, I think we got a breakdown on equipment here. I'm told we got calls, but I guess that they can't hear us. Anyway, one of the objections that people have to the needle exchange program, getting back to needles, is that it's the first step on the road toward drug legalization, that it in fact condones the use of drugs. What do you say?
Nowhere where they've set up syringe exchanges or over-the-counter sales have they legalized drugs. I doubt that the U.S. would be the first.
But what I want to know is this a step in that direction? That's what people complain about. You don't think so?
No, and I don't know of anybody who's advocating syringe exchanges or over-the-counter sales who seriously advocates legalization. I mean, there's some drugs that are just too dangerous to have free distribution or to allow somebody to market them the way cigarettes or alcohol are marketed, and heroin and cocaine clearly fall into that category.
Mm-hmm. Well, I disagree. Many proponents of needle exchange do advocate legalization of drugs. And whether it's true or not, it is perceived that this is a first step toward the legalization of drugs.
Yeah, I think it's true that it's perceived that way. But in Margaret Thatcher in England set up syringe exchanges throughout the country. Margaret Thatcher is not going to legalize drugs in England.
Okay, we're going to make one last attempt here on the phones. Hello, are you there?
Hello?
Uh-oh, how are you?
Hello?
What's your question?
Hi, I have a question for Mr. Johnson.
Mm-hmm.
noticing on Friday evening around 43rd and 8th Avenue, coming home, a lot of drug action there, a lot of drug dealing. I've noticed officers standing there. I've counted 5 of them, and there's drug dealing going on, and they haven't been doing anything. And as a citizen, what are we supposed to do when the law is not being enforced?
This is a great question because I see this all over this city. Drug transactions taking place openly, drug activity clearly out in the open. How come this goes on?
Okay, if you're talking about 43rd Street and 8th Avenue, you're talking about the bus terminal.
Right.
And the Port Authority bus people will tell you, the Port Authority police, and they can give you the stats to back it up. They make thousands and thousands of arrests. They also have a program in which they can observe someone fitting a profile that they will approach and ask, can I look at your bag or something, and they will arrest them. A decision just came down from a judge in which we are appealing that said that this is illegal. So we have problems, mixed signals also. If a police officer in uniform observes what appears to be a drug transaction, he makes an arrest.
This woman is saying that she observed officers who were in the vicinity of drug transactions and nothing happened. I've seen that many times myself. Why is that? I mean, are there cops who are told not to make drug arrests for whatever reasons?
I have been told, yes, that is so. And the reason being that if every cop who went out on a tour of duty saw a drug transaction on 43rd Street and 8th Avenue and they arrested someone, then the whole force would be off the street. So if they see a series of drug transactions taking place, they notify the specialized unit. They will come and make undercover buys, observation buys, and arrest the people, as opposed to the uniform force.
Well, we're worried about what kind of message a needle exchange sends. What kind of message are we sending the community if they see officers who will not move in and make an arrest on drug activity?
They do make arrests on drug activity if it's blatant and out in the open, right in front of the officer's face. But if it's not in front of the officer's face, behind his back or around the corner and the officer standing off to his left, they're not going to do it.
Okay, we got about 30 seconds left, and if you were given, I don't know, $10 billion to start your drug fight, Don, I want to know what's the first 2 or 3 things you do.
Okay, I think the first thing is massive expansion of treatment.
Treatment would start.
Treatment would start. Right.
And Sterling, where would you start?
Education. Because if we stopped every gram of drugs aimed for these shores today, we'd still have a drug problem tomorrow. Because we have this insatiable appetite for drugs. Stop using drugs. Then treatment, prevention, education, law enforcement. But it would be education first.
Education first and treatment. Okay. Clearly the opinions differ on the best way to fight drug abuse and AIDS. But I think there's no disagreement among any of us that we want to rid our society of these 2 killers. We need better treatment, education, and law enforcement efforts, and they cost money, lots of money. And until we're willing to pay that price, we're never going to defeat these problems. Next week on Hotline, New Yorkers fight back. We'll meet some people who have become so frightened of violent crime, they are arming themselves. Does this make the city more dangerous? I want you to join us. I thank my guests, Sterling Johnson, Don Desjardins. I'm Bob Herbert. Thanks for watching.